Well, good morning, everyone. Sounds like a classroom. Good morning, everyone. Good stuff. Well, it's wonderful to be back in Halifax and to receive this warm welcome, but it's especially wonderful to be here with some of the most important people in this country, students who are going to be a part of the backbone of one of my party's proudest achievements, public Medicare. I'm in Halifax today to talk about a critical priority of those kitchen tables, the fact that 5 million Canadians simply don't have access to a family doctor. Now, Canadians like to point to the health mess in the United States, and we're right when we say that what we see there works for nobody. Tens of billions of dollars wasted on private administration, tens of millions of citizens who are completely uninsured. But in the last 25 years, weak leaders in Ottawa have allowed our Canadian public health care system to be slowly and steadily nibbled away. And one of the consequences is the issue that we're addressing here today. And that has to do with the fact that so many of our fellow citizens now don't have access to a family doctor. Having regular access to a family doctor is really the basic business of community health care. It's about regular checkups. It's about early detection and prevention. It's about keeping people well in the first place because your family doctor knows you and your family. And if you don't have that, then you don't really have health care. You have sickness care. You have a system that's about dealing with you when you're seriously ill, not about keeping you well. And that's what they have in the United States. And that's what we're drifting into here in Canada. It's a key reason why our emergency wards are full and why there are so many waiting lists. And it's time that we did something about it. Now, 5 million Canadians don't have access to a family doctor. That's a far more important issue, I would suggest to all of you, than giving more corporate tax breaks. It's time to directly address this problem. And so, if elected as Prime Minister, New Democrats will phase in a program designed to create 50% more training spaces for doctors and nurses. And fully phased in, our program will increase the number of Canadian doctors being trained by 1,200 a year. Fully phased in, our program is going to increase the number of nurses being trained by 6,000, a 50% increase. Now, fully phased in, we'll be committing $200 million a year to this priority, totaling $1 billion over 5 years. And of course, we'll work in close partnership with provincial premiers, like the next Nova Scotia Premier Darrell Dexter, for example. Now, as appropriate, from province to province, we'll make these funds available to increase training spaces and help fund tuition and other learning costs. And we will also design this initiative to encourage graduates to make their careers in family medicine. Specifically, we'll propose that graduating health professionals who begin their careers in family medicine and stay there for at least 10 years be forgiven their student loans. I heard an interesting reaction from the students here because we met with the students last year, a great many of whom would like to have been family doctors, and told me very simply that they had to go on and become specialists because by staying as family doctors, they'd be unable to pay their student loans. And this can be corrected. Now, finally, as a key part of this initiative, we will work with provinces and territories to fix once and for all Canada's foreign credential system so that the trained and skilled medical people that we entice to Canada can finally get to work where we need them the most in our healthcare system. There's a great deal more that we need to do to help Canada's public health care system return to good health itself, and I'll have a lot more to say about that in this election because health care is one of the most important issues in the election because it's facing people as they as they gather in their family discussions around that kitchen table, as opposed to the people who are gathering around the boardroom table. And I'll be talking about helping working families afford the medicines that they need to stay well. I'll be talking about our seniors and their health care needs. I'll be talking about what needs to be done to keep health care public and out of the hands of the privateers and the privatizers and those who want to simply make profit from it. But it starts here, really with the fundamentals. And very fittingly, in the city of Halifax, with its proud tradition of world-leading education. Now, Stephen Harper is a strong leader, all right, but he's the wrong leader on health care, and your family deserves better. Your family deserves a Prime Minister who puts the needs of working families first and who will take health care seriously and to make it a top priority. On October 14th, I'm asking for your support, and don't let anyone tell you that it can't be done. Thank you very much. Merci beaucoup.